Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I am your host, Sheena Wapoose. On this episode, I am joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people you can send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hey, Sheena. Thanks for having me in.
We are doing a early episode this week due to Thanksgiving, so...
Right.
Can you talk a little bit, just one more time, about recommendations for safety as far as Thanksgiving goes?
Yeah, so for Thanksgiving, the safety recommendations are pretty standard across the board from what we've been hearing. You know, if you are getting together with individuals outside of your household, try to keep the number of individuals attending, below the number of 10. I know it's kind of cold. They do recommend eating outdoors. I think that might be for warmer climates and not quite as much a Wisconsin recommendation. But if you're into that, that's an option too. They also recommend bringing your own food, making sure you're not eating communally out of, various dishes, having one individual act as a server, also using utensils and plates that can be discarded afterwards. So single-use things. And that's just to, decrease the opportunity for the spread of COVID. Obviously, wear a mask, and they'd like you to maintain 6 feet between you and other individuals and stuff at the meetings. So please have a happy and safe Thanksgiving. We don't want anyone catching it, during times of celebration. We understand that everyone wants to be around their family and friends, and if they do so, please take precautions.
So this week, we just hear more and more news about vaccines. That seems to be the hot topic right now as far as COVID goes.
Yeah, absolutely.
So will vaccines require more than one shot, and if so, why?
Yeah, so just about every single vaccine requires more than one shot. I actually can't think of one that is only a one-shot exposure. Right now, the three that are likely to come onto the market come from Pfizer, Moderna, and AstraZeneca. They all have about a 90 to 95% effective rate, and they all require 2 shots. Here's why. It's based on how your body's immune system works. The first shot provides your first exposure to antigens, which are parts of a virus or any sort of pathogen. They could be dead viruses, inactivated, or what are called attenuated, which are essentially just parts of a virus. In I believe 2 of the viruses, they're using mRNA. So once that's exposed to the body, the body's B cells or B lymphocytes start producing antibodies, and the T lymphocytes are memory cells, and it starts creating more memory cells. So once your body starts that process, it usually takes several weeks, 2 to 4, depending on the disease and depending on the health of the person, to kind of build up those in the system. So once you do have those built up, there are reasons to get the second shot. They were looking at the tests, and if you do just get one shot, you are protected, but it's drastically reduced. Instead of being like 95% effective, it's only about 60 or so. So it's really beneficial to get the second shot. And some of the reasons you need that is, sometimes the first one doesn't stimulate enough production of B cells and T cells. And this is pretty common with the shot for meningitis that people get. You need that second one for that same reason. Also, you want to ensure that everyone has a strong immune response and stuff, and that really helps to develop that herd immunity. So they'll usually give 2 shots, kind of to make sure everyone's immune system has been exposed and is working properly. In some cases, vaccines, you lose your natural immunity over time. They're finding that people that are exposed to COVID and have had it are losing it. And so that second shot kind of, starts that process over again of making sure that you're going to have a strong enough immune response when you're exposed later down the road. And this is pretty common as well. You see this with like your diphtheria or your tetanus shots. We get those every so often and stuff to make sure our body can still fight that off. And another reason to get the another shot or a second shot is sometimes there's viral mutation. And that's what we see commonly with things like the annual flu vaccine. There are various strains out there. And so each shot holds, multiple types of strains. So you have kind of a broader defense against the vaccine. So why 2 shots? Those are the reasons predominantly why we need 2 of them.
I kind of an off-the-cuff question for you.
Yeah, go for it.
Okay. So we were talking with my coworker this morning, and her husband had COVID really bad, and he still has antibodies. And he got it back in July, I think. We were wondering, does it matter how severely the disease affects you or the virus affects you, as far as how long the antibodies last in your system?
So they're not totally sure about that.
Mm-hmm.
They are finding that some people that are young and healthy have very mild symptoms, and their immunity to it lasts a long time. They're also finding people that have had horrendous cases and stuff are losing their immunity quickly. So they're not totally sure if it's a severity issue.
Mm-hmm.
So maybe they're still encouraging and looking into the kind of the possibility of, even if you have had it, to
mm-hmm.
get a vaccination for COVID as well.
Mm-hmm.
And again, it's to really make sure the immune system is up to fighting it off at a later time. So it depends.
Your favorite catchphrase. It depends. Okay, so what are the potential side effects of a COVID vaccine? I know there's a couple of them, like you said, but...
Yeah, so the CDC hasn't published any hard and fast, possible types of side effects. Each, type of virus and vaccine does have their own side effects. Possible side effects out there, there are a lot of minor ones. And they include, minor versions or minor symptoms of disease. You could have minor soreness, runny nose, congestion, a little bit of swelling around the site. Some people will experience, fevers or chills or headaches. You could have a little bit of joint pain in some cases. Some people will experience sore throats. And in some cases, there's vomiting. So those are all minor types of reactions that are fairly common to this type of vaccine. There are major reactions that people do need to be aware of. These are super uncommon, though. They are literally 1 to 2 people out of 1 million. So it's very unlikely anyone will have these types of reactions. But in the event that they experience them, they do need to call, a healthcare professional or, 911. And they could be allergic reactions and stuff where there's major swelling, or they could have an anaphylactic type of reaction where it actually closes off their esophagus. They could have seizures. Some people may experience fainting, and then in very rare cases, people could die from it. I mean, this is a medical intervention. Most of the time, the prevention, which is what a vaccine is it far outweighs the risks of actually contracting the disease. You're far less likely to die from this shot than from actually getting the disease. So that is a possibility. Those are some of the things to watch out for. I'm just going to put this to bed right now. For the record, vaccines do not cause autism. I don't know how or where that rumor started, but there have been a lot of studies out there for the past 20 years that have debunked that. If you get this vaccine, if your son or daughter gets it, it will not cause autism. It's much safer for them to get this than to kind of take a chance, roll the dice, and not get it.
I asked this question because I had seen an article about people saying it should be advertised that you can feel a little sick,
right,
as a side effect, because they were talking about, that possibly affecting people wanting to go back and get the second shot, once they, you know, kind of experience those side effects.
Yeah.
So maybe if they're prepared for it and know it's just a normal part of it, you know.
Yeah, exactly. And that's what you're trying to do, actually, is you're trying to trigger an immune response. And when you are sick, that's your immune system working to flush viruses or bacteria out of your body. It's not necessarily that you're being harmed by the pathogen at the time. So if you do experience, you know, mild symptoms after the vaccine, you know, throw yourself a little party. The vaccine's doing its job, and, you know, wait until you're supposed to get that next shot, and please show up to do so.
That wouldn't make you contagious at all.
No, the way the vaccines work, when they give you, you know, attenuated pieces of the virus, it means that it can't replicate in your body, and so you wouldn't be able to pass it on to others. Yeah.
Cool. All right. So in this week, it was mentioned in PSAs about local hospitals being full. So can you just talk about the consequences of having such full hospitals?
Yeah, without sugarcoating it, it means that patients with severe cases are at a much higher risk of dying and stuff, because they wouldn't be able to get either the pharmacological intervention they need, the medicines they need, or in extreme cases, they wouldn't have access to ventilators. And so they might have to be transported to somewhere else. We've heard of cases, you know, far to the north of the reservation right now, where individuals have been transported clear down to Milwaukee for treatment. That, you know, increases risk of community exposures, not just to COVID, but to other types of diseases and illnesses. And if you're already fighting COVID off, you don't want to be exposed to additional viruses. So it just puts you at greater risk for more exposure. And delays in treatment, especially with severe cases that need to be hospitalized. The timing really is important, and the sooner you can perform medical intervention, the better. And so it just increases the risk unnecessarily. And so if we can slow the spread through our actions and behaviors, hopefully we can bring down the number of cases in our hospitals right now, allowing those that really need to be there to receive the treatment in a timely manner.
So I came across this COVID tracking project, which is in the Atlantic, and I was just kind of going through the data that's on there. And for Wisconsin, it shows that Native Americans are disproportionately more likely to die of COVID. And can you speak to why that would be?
So I haven't seen the specific data you were looking at, but I have read several meta-analyses where, you know, various studies are all brought together and all the data is analyzed as one giant congregate whole. And, you know, we have seen that Native Americans are, you know, affected at a higher rate than some of the others. This might be due to several of the factors surrounding how Native Americans live. Specifically, a lot of them live in multi-generational homes and have a high number of people living in close proximity. So that is one reason that, or that type of scenario, I should say, allows for COVID to be passed on to more people at a more rapid rate. In addition to that, a lot of Native Americans suffer from other comorbidities that are more severe or lead to more severe cases. These include things like obesity, which causes hypertension, and diabetes. All three of those comorbidities are seen to drastically increase the risk of having a severe case or causing death if you contract COVID. Some other conditions that are also very common in the Native American populations include things like heart disease and heart failure, and renal or kidney failure. And that's very common if someone has diabetes. It's very common to see kidney problems associated with diabetes. And so all of those kind of come together as a perfect storm and make cases more severe. So if you have a population prone to those things, you also have a population much more prone to severe cases of COVID. So yes, I can understand and see why it's disproportionately affecting them if, you know, you already have a population experiencing comorbidities piled on top of what could occur. Yeah.
So how common is delirium or confusion with COVID? I don't think we've talked about that. symptom before.
Yeah, fortunately, delirium's a very uncommon symptom for COVID. However, if someone does experience delirium while they are infected with COVID, it's potentially a very serious issue, because it means it could be compromising their vasculature to their brain, and they need to see a medical provider immediately or contact one immediately. Unfortunately, the sample size isn't large enough to specifically focus and target in on specific genetic or ethnic groups. So, we can't say whether or not that would affect Native Americans more than, Asians or African Americans or Caucasians, just because that sample size is so small, which is good because we don't want to see those complications with our patients.
Right. Does it affect a certain age group more so than others?
I haven't seen anything regarding age. It does seem like it affects older patients more.
Okay.
They tend to be the ones that have more vasculature complications and stuff with COVID.
So do you have any tips to deal with COVID fatigue, which is just basically feeling burnt out, talking about the pandemic, thinking about the pandemic, dealing
I totally
with the
understand
pandemic?
the burnout, the COVID burnout. Everyone's different and they all deal with stress differently. The most important thing to do in a case like this is to deal with the stress in a healthy manner. This may be talking with friends or family. This may be, creating something, engaging in a hobby that you may enjoy. I like pottery. I don't do it often, but I find it very therapeutic. It's like playing with dirt, and I like that. Some people just may find it a struggle to engage in the activities they enjoyed previous to COVID. I mean, there's a lot of people suffering from depression right now, and if people are finding it hard to enjoy small things that they experienced before, it's really a good idea to reach out for some professional help. I know the behavioral health department at the Menominee Tribal Clinic has done an excellent job of doubling the amount of time and opportunities for people to go through the intake process so they can start speaking with therapists. So they've really opened up opportunities to see more patients. There shouldn't be any type of stigma or stigma associated with seeing someone like a therapist. I mean, they're there to help get you through difficult situations. And sometimes it's really helpful to talk to someone that has an outside perspective on your life and can provide some objective feedback and opinions. It's understandable to be stressed out if you're struggling. This has been a challenging time for, I would say, everyone. I think that's pretty fair to say that it's caused a lot of stress. But reaching out for help can really help clear a lot of things up. Another thing that is kind of interesting, if some people, they've done studies and they found if some people take the time to step back from things like news and social media, it actually improves their mood.
That doesn't surprise me.
It kind of deals with the amount of exposure. If you step back for a little bit, you can kind of let yourself reflect on where you're at, what you're doing, how your family is, and it can help lower a lot of stress regarding the COVID situation. I mean, there are only so many things that we can do in our sphere of influence that will change the outcome of this pandemic. And I think understanding what we can and can't control and not stressing out about those things that we can't control will definitely help us move through this and cope with what happens in the end. We actually have a couple different web links that we can actually post in the show notes that have a lot of resources from the CDC and other Wisconsin-based organizations that can help people deal with some of the things that are going on too. So reach out for help. Don't go it alone. Yeah, I'll send you that.
I feel like
link.
the COVID stress and then like seasonal depression is just like mixing together right now.
Yeah.
And the sun sets at like 4:30. So
I was talking to my wife. I was like, so when's the winter solstice? We're almost done with this, right? And she's like, it's in December. I'm like, okay, I'll just take it.
Yeah. So Just as a quick follow-up question, is there anything available like virtually as far as through the behavioral health department?
I know our behavioral health team is doing a lot more over the phone work. We've been trying to get some virtual, face-to-face type video conferencing in there as well. We're working on that too.
Okay.
So we're trying to reach out more and make sure everyone can have someone to talk to if they need it.
Do you have any parting thoughts for people before Thanksgiving here?
I hope everyone has a safe and healthy Thanksgiving. I know one of the things that drastically improves my mood is actually reflecting on things I am grateful for. And funny thing is, they've done studies on the act of gratitude, and they've found it improves everyone's health when they engage in something that helps them feel grateful for what they have. And I think, all things considered, given everything that's happened in 2020, we still have a lot of great blessings living here in Wisconsin and in America. And I hope everyone can take time to reflect on those things too, because I think that'll help them get through this situation.
Thank you, Vaughn.
You bet. Thanks for having me.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we welcome any community questions you have regarding COVID-19, so please send them in to us via email at podcast@mitw.org.